Here's a scenario for you that I want you to imagine. Maria's father, Ray, is an 84-year-old retired postal worker in San Jose. His health has declined after a stroke. He needs help with meals, bathing, and medications, but the family can't afford $7,000 a month for assisted living. They've heard whispers about a Medi-Cal program that pays for assisted living, but when they started searching, they're overwhelmed. ALW, MasterCare, CalAIM, three different acronyms, three different phone numbers, and zero clarity. Ray's daughter called me in tears. She said, "Dale, I don't know what's real anymore. Can Medi-Cal actually help us, or is this just a myth?" If that sounds familiar, this episode is for you. Hi, I'm Dale Corpus, a Senior Transition Specialist and real estate expert based in the San Francisco Bay Area. This is another episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast, where I share real stories, expert insights, and practical tips to make caregiving and senior planning easier. Today, we're unpacking how Medi-Cal can help pay for assisted living, specifically the difference between the long-standing assisted living waiver, ALW program, and the newer Master Care program that's part of California's CalAIM initiative. Let's dive in. Let's start with what families think versus reality. Most families assume Medi-Cal only pays for nursing homes. For years, that was true. If mom or dad needed round-the-clock care, Medi-Cal would help in a skilled nursing facility, but not in assisted living. That gap left thousands of middle and low-income seniors with no realistic option. That's why California created the Assisted Living Waiver, ALW, back in 2006. It started in a few pilot counties, including Alameda, Contra Costa, and San Francisco, and expanded statewide over time. The goal was to help Medi-Cal eligible seniors move from nursing homes into community-based care like RCFE, board and cares, or assisted living settings. But as the population aged and waiting lists exploded, the state realized that ALW wasn't enough. Enter MasterCare, a next-generation program under CalAIM designed to simplify and expand access. Let's talk about how the ALW program works. Here's a quick refresher. The ALW pays the care portion of assisted living costs, things like help with bathing, dressing, meals, and medication management. Families are still responsible for room and board, typically $1,000 to $1,500 per month, depending on income. Participants must 1, be on Medi-Cal, 2, meet a nursing home level of care, 3, live in or agree to move into a participating ALW facility. Each participant is assigned a care coordinator who builds a plan, approves a placement, and submits it to Medi-Cal for reimbursement. The good news, it can save families thousands each month. The bad news, wait lists. In some Bay Area counties, it can take 6 months to a year to get in. Now, let's bring in MasterCare under CalAIM into the picture. MasterCare was launched to fix what ALW couldn't. It's part of California's CalAIM reform, which stands for California Advancing and Innovating Medi-Cal. Think of MasterCare as ALW 2.0, broader, faster, and more flexible. Instead of operating as a small waiver with limited slots, MasterCare is a managed, care-based program run through Medi-Cal health plans like Anthem Blue Cross, Health Plan of San Mateo, or Alameda Alliance. Here's what makes it different. No statewide waiting lists. Enrollment happens through your managed care plan. Broader services includes in-home support, respite, adult daycare, and assisted living coverage. Continuity of care. You don't age out. Services adjust as needs change. Local case management, care coordinators within your plan oversee transitions. If ALW felt like a maze of paperwork, MasterCare is meant to be a single doorway connecting families to the right care setting faster. Let's give you an example. Let's talk about the Nguyen family in Fremont. Mr. and Mrs. Nguyen live in Fremont. Mr. Nguyen has Parkinson's and Mrs. Nguyen is his caregiver They're both on Medi-Cal through Alameda Alliance. Through MasterCare, their health plan covered in-home caregiver support 20 hours per week, adult day health participation 3 days a week, a future transition plan to assisted living if Mrs. Nguyen can't continue caregiving. Under the old ALW, they'd had waited months for approval. Under MasterCare, services started within 6 weeks. No middlemen, no waiver wait lists. That's the difference. Now that we've covered what both programs are, let's break down the key differences between the Assisted Living Waiver, or ALW, and MasterCare under Cal-AIM in plain English. First, who runs each program? The ALW is administered directly by the state through a waiver system, while MasterCare is run through Medi-Cal managed care health plans. That means ALW is more of a state-controlled process, and MasterCare is handled by your parents' actual health plan, like Anthem Blue Cross, Health Plan of San Mateo, or Kaiser. Next, waiting lists. ALW programs often have a long waiting list, sometimes months or even a year. MasterCare, on the other hand, generally does not have a waiting list since it's coordinated through managed care plans. Then there's availability. ALW only operates in about 45 counties across California, while MasterCare is statewide as long as the local managed care plan offers it. So MasterCare reaches far more families. Let's talk scope. The ALW only covers assisted living services. It's focused solely on those facilities. MasterCare goes further. It can fund care at home, in assisted living, through respite care, or even at adult day health centers. It's part of what Cal-AIM calls a continuum of care. Next is flexibility. ALW tends to be a rigid, rules-based program with strict state procedures and approval steps. MasterCare gives each managed care plan more freedom to adjust services around the person's needs, so it can evolve as your parents' situation changes. And finally, the overall goal, ALW was designed to reduce nursing home placements. MasterCare's mission is broader, to create an integrated system of care that keeps seniors as independent as possible wherever they live. So to sum up, ALW is limited, slower, and narrower in focus. MasterCare is newer, more flexible, but built for today's Medi-Cal families. Next, let's talk about who qualifies and how to apply. If your parent already has Medi-Cal managed care, call the number on their plan card and ask for community supports, assisted living, or MasterCare program options. If they're on fee-for-service Medi-Cal, ask the county Medi-Cal office about transitioning to a managed care plan that offers Cal-AIM community supports. It's also smart to connect with a case manager at your parents' clinic or hospital, an RCFE administrator familiar with Cal-AIM billing, a senior transition specialist like myself, who can help align the care plan with housing and financial goals. I think it's a good time to cover some common misunderstandings. 1, Medi-Cal pays the entire assisted living bill. False. It covers care services, not room and board. 2, you can apply online yourself. Not really. Applications run through approved providers or plans. 3, all communities except ALW or MasterCare, many don't. Always ask before touring. 4, it's only for low-income seniors. Not necessarily. Some middle-income seniors qualify through share-of-cost structures. So why does this even matter now? Well, the baby boomer wave is here. By 2030, 1 in 4 Californians will be over 60. Programs like MasterCare aren't just financial tools. They represent a shift towards aging with dignity at home and in community. If you're an adult child in the sandwich generation, knowing how these programs work could save your family thousands and prevent crisis moves. So let's recap. Here's what we covered today. 1, Medi-Cal can help pay for assisted living through ALW and MasterCare. 2, ALW is the old waiver with wait lists. MasterCare is the newer Cal-AIM version with broader services. 3, both programs aim to keep seniors safe at home or in community care without bankrupting families. 4, work with a senior-focused professional to navigate applications and housing options in the Bay Area. This has been another episode of Sandwich Generation Solutions powered by the Simplify Senior Transitions podcast. If your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com. Have a quick question? DM me on Instagram at soldbydale. And don't forget, you can also listen to the Simplify Senior Transitions podcast on YouTube, Spotify, Apple Podcasts, and all major podcast platforms. If this video was helpful, hit like, subscribe, and share it with someone who needs this information. Thanks for tuning in, and I'll see you on the next episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast.